Assalamu alaikum viewers, this is Dr. Mashood Ghazi again with a video about an update on COVID-19. A couple of days ago there was a policy statement about a research paper which is about to be published in UK. This was regarding a medication called dexamethasone, and it's been quoted as a very life-saving medications in COVID-19 patients treatment. Let's talk about this policy statement which was published by the chief investigators, two of them, Professor Horby and Professor Landry. This statement pertains to our research which is named as RECOVERY, which stands for randomized evaluation of COVID-19 therapy. In this research, multiple treatment options were looked after for the COVID-19 patients. One of those was the use of dexamethasone. The paper is a randomized controlled trial, and as we all know, in the literature, in the medical literature, randomized controlled trial is one of the highest levels of evidence which is out there. In this trial, what they did, they randomized into two groups. In the first group of patients, they received dexamethasone. They received a dose of 6 mg per day for 10 days, either IV or oral. In the next group, they did not receive dexamethasone, but they received the usual therapy. Let's talk about the results. There were a total of 11,500 patients which were enrolled in this study. It was rolled across 175 hospitals in UK. In the group which received dexamethasone, the total number of patients were 2,104, and in the other group which did not receive dexamethasone, total number of patients were around 4,321. The primary outcome or the endpoint was the 28-day mortality or the death rate. Now, when we look at the dexamethasone group, there was a significant reduction in the mortality rate. It was 1/3 less compared to the other group in patients who were ventilated. And in the dexamethasone group, it was 1/5 less in patients who received oxygen treatment as compared to the other group. Now, when we talk about the group or the arm which did not receive the dexamethasone, they received the usual treatment, or they were the control arm, the death rate at the 28-day mortality was 41% in the ventilated group, and the mortality was intermediate in the group which received oxygen, which was around 25%, and 13% was the mortality rate in the group in which patients did not receive any treatment. However, when we go back again to the dexamethasone group, we can talk about certain statistical results. In the group which were ventilated patients and they received dexamethasone, the rate ratio was 0.65 and the confidence interval was 0.48 to 0.88 with a p-value of 0.003. When we just talk about the numbers, the confidence interval, the 95 confidence interval, was quite narrow, which shows it was clinically significant, as well as the p-value was less than 0.05, which again suggests these results were statistically significant. Again, if you talk about the dexamethasone group again, but we talk about the patient who received oxygen therapy, but they also received dexamethasone, the rate ratio over there is mentioned at 0.80 with 95% confidence interval between 0.67 to 0.97, and the p-value equal to 0.0021. Again, we see both the confidence interval, the 95% confidence is quite narrow. Again, it shows it's clinically significant, as well as p-value is less than 0.05, which again suggests it's statistically significant. Although these results are both statistically significant, but the flaws in this paper are couple-fold. The first one is, out of the 11,500 patients, we don't know anything about 5,075 patients, because nothing has been mentioned in this statement about those patients. So we can see there's a lot of dropout ratio, or a lot of patients, around 45% of the patients, which have not been accounted for. Hence, we have to wait for the whole paper to be published first, so we can critically analyze or appraise this paper again in further details. Again, if you go back to dexamethasone, now that drug's been around for a long time. It has been used for things like refractory shock in severe sepsis, as well as life-threatening asthma. But one of the most important side effects or complications of using dexamethasone is adrenal crisis. Now, we can't just blindly start using dexamethasone in all COVID patients. First reason being, it has shown no effect or benefit in patients who don't require any oxygen therapy or ventilated patients. And it has only shown effect in very critically unwell patients which are either ventilated or require oxygen therapy. Hence, first of all, the bottom line is we cannot use dexamethasone for every COVID patients. So we have to be very selective in the type of patients we have to use dexamethasone. And again, this drug's been around for a long time in countries like Pakistan, India. It has already been used and is currently being used even before this statement came back for COVID-19 severe patients. So this medication is not revolutionary. It's been there for a long time. It has been used and it is being currently used in COVID-19 severe patients. But we have to take this paper with a pinch of salt. We have to look at the shortcomings of this paper again. There's a lot of limitations for this paper. Once it gets published, we will do another video and talk about this again. For the time being, we have to take this paper with an open mind, and we cannot start using dexamethasone for every COVID patient. We have to be very selective. Thank you very much.